Hi, welcome to the treatment group video for neurodevelopmental disorders. My name is Angelo Allegretto. My client's name is Nicolas Forrester. He is 8 years old. There's one differential diagnosis, and that is attention deficit hyperactivity disorder. There's one primary diagnostic feature, which is impairment in inability to focus and concentrate for significant periods of times, along with hyperactivity and behavior. Okay, now we're going to go into Nicolas's story for a little bit. Nicolas is an 8-year-old. He is having some issues in class. His teacher explains that he's continually disrupting the class and blurting out answers without raising his hand. And when he raises his hand, he gets called on, and then he doesn't know the question, like the answer to the question. He's constantly bugging his classmates when they're trying to get work done, and he's engaging in attention-seeking behavior when he should be doing his classwork. The teacher has to repeatedly remind him to stay seated. On the playground, he alienates himself from his classmates. His tendency is to disrupt games and invent his own, in his own rules, and for the games that the other kids are playing. He's able to get attention from others, and if he engages in daredevil behaviors or takes on the role as class clown. When it comes to team sports, he's usually the last to be chosen because he is unreliable. For example, in the game of softball, it's not unusual for Nicolas to allow his attention to drift. He has no academic struggle, so the teacher expresses concern when he doesn't turn in his homework, but it's not that because he's not doing his homework. Actually, his mom states is really relatively surprised when she gets the news from the teacher that he's not turning in his homework because he's doing the homework at home and just deciding not to turning it in. So he does his homework, and then he would rather be going off playing like games or in the backyard. While he's at home, he complains about being bored, and there's nothing to do. And complains that there's nothing to do. When he was 2 years old, he woke up and his parents were still sleeping and decided to go on a little walk. And he attempted to cross a busy highway. Luckily, the police were able to pick him up, and no danger was happening. When his dad hears of the news, he just kind of shrugs it off like, boys will be boys, or that's my boy, like when he's becoming like the class clown, or saying like things like the apple doesn't fall far from the tree. But Nicolas's father is never really in his life because he's in his life, but not in his like day-to-day life because he has a busy work schedule. He had a physical assessment, and it just said the doctor says that he's relatively healthy for an 8-year-old boy, and that's pretty much it for Nicolas Forrester's story. For the multi-axial diagnosis, on axis 1 is attention deficit hyperactivity disorder, axis 2 is none, axis 3 is none, axis 4 is school difficulties, and axis 5, the GAF score is 60. There's only one theoretical perspective, which is the biological perspective. The client may be suffering from a genetic predisposition. More specifically, researchers show that he may have a thinner brain in areas associated with attention, so a little bit of abnormal brain structures. Also, the prenatal factors may be in a role, which include smoking or drinking during pregnancy, has been associated with ADHD, and that will wrap up the treatment group video.